I'm speaking to David Culver of Asanté Centre in Drogheda, and David is going to tell us more about emotional freedom technique, also known as EFT. David is going to demonstrate the technique on myself, and so I will hand over to David. David.
Thank you, Mel. It's great. So I'm going to do some EFT with you. Before I start, I just want to say a couple of things about EFT. EFT is a meridian therapy. It works on the same way as acupuncture, on the meridian lines within the body, the energy lines that flow through it. I've often explained what EFT is and described to people how it works, but the most important thing with EFT is that you actually experience it. Then you will realise that it is actually a very, very effective form of therapy. And that's why I've asked Mal to be my client for these few minutes. And Mal, you talked about having some pain in your shoulder, yeah?
Yes, my left shoulder.
Your left shoulder?
Yes.
Okay, and how long have you had it?
On and off since 2001 when I dislocated my shoulder.
Right, okay. So if you notice there, Mal said that she has pain in her left shoulder after a dislocation many years ago.
Yes.
A good few years ago. Okay. Well, EFT, as I say, it works on the same principles of acupuncture, but instead of using needles, it works by tapping. Tapping on certain points, particularly of the face and the body, and sometimes the hands. But we're not going to use the hands just for this session. We're just going to concentrate on the face and the body for the purposes of this demonstration. Okay, so first of all, the pain that you have there in your left shoulder, what kind of pain is it?
At this moment in time, it's more of a presence, a niggling discomfort.
Niggling discomfort, yeah, it's okay. And that's very important that you actually describe the sensation of the physical pain in your own words. Okay, so it's a niggling sensation.
Yes.
Incidentally, I'm going to demonstrate EFT on and help Mel with the physical pain that she's experiencing. But quite often I also use it on the physical experience of emotional pain as well, such as depression, anxiety, and all those other different kind of problems. Okay, so now where do we start? The first place to start is to actually focus on that pain, that niggling pain in your shoulder. And maybe you can tell me, give me a number on a scale of 1 to 10, how strong that pain is.
I would say about 6.5, possibly 7.
6.5 to 7,
yeah.
That's good. Okay, so 10 would be as strong as it gets, and 0 would be no pain at all. And this is very, very important, because we want to know, obviously, if the sensation of pain has changed, hopefully to reduce it. So 6.5 to 7. Okay, so it's a niggling pain in your left shoulder. Okay, all right, now with EFT, the first place that we start tapping, okay, is on the karate chop here. Okay, so while you're watching this film, maybe you'd like to tap as well, and just tap there with the 2 fingers on the karate chop, okay? And what I want you to do is, while you're tapping, I want you to say these words with me. Even though I have this niggling pain,
even though I have this niggling pain
in my left shoulder,
I
deeply and completely accept myself anyway.
I deeply and
completely accept myself anyway. Once more, even though I have this niggling pain,
in
my left shoulder,
I
deeply and completely accept myself anyway. And once more, even though I have this niggling pain, in my left shoulder, I deeply and completely accept myself anyway. Okay, now I want you to tap on your eyebrow, the nearest point to the middle, again with the 2 fingers. That's it, just tap there gently, okay? And shorten it and just say, this niggling pain in my left shoulder.
This niggling pain in my shoulder.
This niggling pain in my left shoulder.
This niggling pain in my left shoulder.
Okay, then the side of your eye. You might just lift your glasses up a little like I do. This niggling pain in my left shoulder.
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 Then underneath your eye, this niggling pain in my left shoulder.
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 Then the middle of your top lip. This niggling pain in my left shoulder.
This niggling pain in my left shoulder.
This niggling pain in my left shoulder.
There's niggling pain in my left shoulder.
Below your bottom lip. There's niggling pain in my left shoulder.
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 Then your collarbone. There's niggling pain in my left shoulder.
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 Then lift up your arm and just tap under your armpit with the flat of your hand now. There's niggling pain in my left shoulder.
I'll probably do that arm.
Doesn't matter which
Okay.
arm, yeah, you can do it with either arm, by
Okay.
the way. There's niggling pain in my left shoulder.
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 And then go to the top of your head and just tap with the top of your head. There's niggling with the hand on the top of the head. There's niggling pain in my left shoulder.
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 Okay, now just relax your hand. Okay, and just take a deep breath now. That's it. And you might just take a drink of water. It's very important to drink water while you're doing this because people often become dehydrated.
Mm. I could feel that in my throat.
Yeah, sure, absolutely, it's quite normal, you know.
Yeah.
So the next thing to do is just to gauge it again on a scale of 1 to 10, how strong the pain is. Is there any change in it? Is it still 6 to 7? Now, I want you to tell me
Yeah.
honestly if it's the same. It's very important. This is a real demonstration. It's not a setup or anything. Is there any
I
change?
would say the 7 is definitely gone, and even the half is definitely gone.
Right,
So it's more
good.
of a 6.
About a 6, yeah?
Yeah.
So quite often during the first round of tapping we get some change, even a small reduction by maybe 1 point. Incidentally, just while I'm doing this demonstration, I want to just mention a few things that people often ask. It doesn't matter which side you do the tapping, you can do it on the left or the right hand side. Okay? It doesn't matter how many times, usually about 7 is the amount of times you tap. But it doesn't really matter, as long as you tap on all the points, that's very important.
For the people at home watching, David, I have to say I feel a different kind of thing. It's kind of, can I say, it's dispersed.
Dispersed.
Over.
Absolutely.
Over the
Sure.
arm, the upper shoulder.
Right, yeah, which is quite interesting. As I said to you before, what we look for is change. Change in the sensation. Sometimes with pain, the pain can actually move, and in the same way as you're saying, and I think you mentioned beforehand when I asked you before we started filming that it was a line, and now it's more diffuse, is it?
Yes.
More dispersed?
Yes, much more dispersed.
Absolutely. And as I said to you, this is what we look for most of all. We look to help people change. Because often people come to me here and they say, I feel anxious, or whatever the sensation that they feel in their body, and they say sometimes that it sits there for a long time. And what I look to do is to help them change. And for energy purposes, we're looking for to actually get the energy moving. And that's what the sensation is. It's the energy moving there in your shoulder.
Yes.
Okay. So it'll be around a 6 now, would it?
Yes.
Okay. What kind of pain is it now? Is it still a...
It's not so much of a pain as it would
Yeah.
probably be more
Sure.
a weight
A
and
weight.
discomfort.
A weight and discomfort.
Yes.
Yeah, sure. So there's a weight to it now,
Yes.
and a discomfort.
Yes.
Okay.
But not a completely unpleasant one either.
No. Okay.
It's just a presence.
A presence, yeah, sure. I know. Sometimes it can be very hard to describe pain. It really can, especially if you're sitting still. It's usually much easier to describe what pain feels like when you move. Okay, and we don't really have time to go through that here, but sometimes what I would do is if somebody says to me, for instance, it really hurts when I move my arm, then I might suggest them they move it gently just to see if there's anything there, but we don't really have time during the session to do that. I'm going to really concentrate on how it is for you when you're sitting still. Okay?
Okay.
And then you can see maybe another time if there's how the pain has changed or the discomfort has changed when you move. Okay, so there's a weight to it. So is it a heavy pain now, is it? Or heavy discomfort?
No, I wouldn't even say that it's heavy.
Right.
It's just
A weight.
a weight.
Right, okay. Right, and it's a discomfort, you say, a presence. That's the word you used, wasn't
Yeah.
it? Yeah. And on a scale to 1 to 10, how strong is that now?
seem to have gone away a little bit.
Seems to have gone away a little bit.
Yeah.
That's
I would probably
interesting.
say now it feels more like a 5